Okay, so I'm going to be doing my head-to-toe assessment for Maryville University for my advanced health assessment class. And this is Brandon. He's volunteered to be my patient for today. So before starting, I've already asked Brandon to empty his bladder. We've tested his visual acuity with the Snellen chart and with the Rosenbaum chart for near vision. I've washed my hands, I've taken a full set of vitals, and I have taken his height and weight. So we're going to go ahead and start. So I'm going to go ahead and start with the head, with inspection of the head and the face. I'm going to look at symmetry at contour, symmetry of his facial features, look for any unwanted movements. I'm going to look at the skin, make sure it's uniform in color, any lesions. I'm going to go ahead and palpate the facial bones for any areas of tenderness. I'm going to palpate his scalp, make sure it's freely movable, any depressions, any lesions, any masses, and any areas of tenderness as well. Then I'm going to go ahead and palpate the sinuses, so his frontal and his maxillary. I'm going to palpate for the JMT. So I want you to go ahead, Brandon, and open your mouth and close it. Okay, and there shouldn't be any pain when he does that, and I shouldn't hear any popping, any locking, or any crevices, which I didn't, so that was okay. Now I'm going to go ahead and assess for light sensation. So this is testing the trigeminal nerve, so cranial nerve. So what I'm going to do is I'm going to ask you to close your eyes, and then I want you to tell me when you feel stimulus, okay?
Yes. 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 Yes.
Okay, good. So we're done with that. Now I'm going to test the facial nerves. So I want you to go ahead and close your eyes tight. Okay, you can open them. I want you to go ahead and wrinkle your forehead. Okay, good. And I want you to smile. Okay, puff out your cheeks like that and stick out your tongue. Okay, good. I'm going to go ahead and move to the eyes. So I'm going to begin with inspecting the outer structures of the eyes. I'm going to look at the eyebrows. I'm going to look at the distribution of the hair. I'm going to look at the eyelids for any ptosis. I'm going to look for the eyelashes, making sure that they go outward away from the globe, for any erythema, any drainage. I'm going to palpate right where the lacrimal glands are, which they should be non-palpable, and this should be non-tender. I'm going to palpate the lacrimal apparatus for any tenderness, any overproduction of fluid. You can go ahead and open your eyes. And then I'm going to go ahead and inspect with my pen light. I'm just going to take a look at his conjunctiva and his sclera, so just look up for me into the side and then look up into the side. Good. And sclera should be white, and conjunctiva moist and pink, no erythema and no drainage present. So I'm going to check for pupillary reflex response. So I want you to go ahead and just look directly at a point at the wall, and I'm going to check for direct, and then for consensual, and same thing. I'm going to check for direct and for consensual. I'm going to go ahead and do a few tests. Okay, so we're going to start with extraocular movements. So we're going to be testing cranial nerves 3, 4, and 6. So just with your eyes, not with your head. I want you to go ahead and just follow my finger, okay? And then follow it to the bridge of your nose. Good. Okay, so right there we could say that pupils are equal round, reactive to light, and to accommodation as well. I'm going to test your peripheral vision. So I want you to go ahead and cover your right eye. And I'm going to test it against my peripheral vision. So I want you to tell me when you see my fingers, okay?
Yes. Yes.
Okay.
Yes.
Okay, good. Cover your other eye now.
Yes. Yes. Yes.
Okay, good. Okay, now we're going to do the uncover cover test, which tests for strabismus. So I want you to fixate at a point at the wall and look straight at it, and then I'm going to ask you to cover your right eye. Okay, and go ahead and cover your left. Good, and as he's doing that, I am watching the opposite eye for any movement, any nystagmus. Okay, I'm going to go ahead and test with do the fundoscopic examination. So what I would do is with an ophthalmoscope, but I'm going to go ahead and check his right eye. I'm going to make sure that I do hold it with my right hand and use my right eye as well. I'm going to go ahead and stand at about arm's length of him, and the first thing I'm going to do is check for the red reflex. And then I'm going to move towards him, always making sure that I have my hand here just in case I hit him on accident. So I'm going to go ahead and look in, and I'm going to dial up if I want to look at the anterior structures, and I'm going to dial down to look at the posterior structures. So when I'm looking, I am looking for the vessels, and I can go ahead and follow the vessels to the optic disc and go out the 4 quadrants, which would be nasal superior, nasal inferior, temporal superior, and temporal inferior. Okay, and then I'm going to go ahead and check his left eye. So I would put the ophthalmoscope in my left hand and look with my left eye as well. Again, first checking for the red reflex, coming in temporal approach, always bracing myself here and doing the same thing. I'm going to go ahead and look at the posterior structures, and when I'm doing that, follow the vessels to the optic disc and to the 4 quadrants. Okay. So we are done with the eyes. I'm going to go ahead and inspect the ears. I'm going to look behind the ears. I'm going to look for any masses, any lesions. I'm going to go ahead and look at the symmetry of the ears. I'm going to palpate the auricles, make sure there's no tenderness and I don't feel any masses. And then I am going to grab my otoscope, and then I'm going to look inside. And I'm going to make sure that my pinky is here so I don't hurt him. I'm going to pull up and back, and I'm going to look, make sure I have a good cone of light. I'm looking for the tympanic membrane, any bulging, any retraction, and I'm going to follow that cone of light into the to visualize the bony landmarks. I'm going to go ahead and do the same thing to the other ear. And hold the otoscope this way, and you can just turn like that for me. Again, I'm going to pull up and back. Visualize the tympanic membrane, any retraction or bulging, good cone of light, and the bony landmarks as well. Okay, so now I'm going to test the auditory nerve. So I'm going to stand behind you, Brandon. I want you to cover your left ear, and you're going to repeat what you hear me say, okay?
Orange.
Okay, good. I'm going to go around, and you're going to cover your right ear.
Apple.
Okay, good. We're gonna do the Ryan-Weber test. So we're gonna start with the Weber. I'm gonna strike the tuning fork. I'm gonna place it right in the middle, and you're gonna tell me if you hear it equal on both sides or you hear it better on either side. Okay?
Equal.
Okay, good. And this test for sensorineural versus conductive hearings. Okay, and I'm gonna do the Ryan test. We're going to compare air versus bone conduction, so I'm going to strike it, put it on the mastoid bone, and you're going to tell me when you don't hear it anymore, okay?
No.
Okay.
No.
Okay, good. So his air conduction should be twice as long as bone conduction. So as he's doing that, I'm counting in my head, and we're going to go ahead and do the same thing over here.
No. No.
Okay, good. Alright, so now we're going to go ahead and move on to the nose. So I'm just going to begin with inspection of his nose. I'm going to look at the bridge. I'm going to look for any deformity. I'm going to look at the skin for any lesions. I'm going to ask you to tilt your head back a little bit. And I'm going to, with my pen-like look, I'm going to look at the mucosa. I'm going to look at the turbinates. I'm going to look for any polyps, any erythema. I'm going to look at the nasal septum, making sure that it is midline. Okay? I want you to go ahead, and I'm going to check the patency of your nares. So I want you to go ahead and just cover your right nair, and then you're going to breathe in. Okay, good. And then go ahead and do the same thing to the other side. And breathe in. Okay, good. Now we're going to move on to the mouth. I'm going to inspect the symmetry of the lips. I'm going to look for any cracking in the lips, any edema, any lesions on the lips. Then I'm going to go ahead and ask him to open his mouth. I'm going to grab the tongue depressor with my dominant hand. Go ahead and open your mouth for me, Brandon. And I'm going to go ahead and just inspect the oral mucosa, make sure it is pink and moist, looking for any lesions. I'm going to look at his teeth. Go ahead and stick your tongue out for me. Good. Put your tongue up. Lift it. Good. I'm going to look underneath the tongue for any signs of oral cancers. Go stick your tongue to the side and then to the other side. Good. I'm going to look at the lateral aspects of the tongue as well. Okay, I'm going to depress your tongue. Okay, I want you to say ah. And as he says ah, I'm watching the soft palate and the uvula rise midline symmetrically. I'm looking at the tonsils for any enlargement, and I'm looking at the tonsillar pillars as well. And then I'm going to go ahead and test for the gag reflex, okay? And gag reflex is intact. So as I did that, I saw that he had good movement of his tongue, which tests the hypoglossal nerve as well. The glossopharyngeal and the vagus nerve were also tested. I'm going to go ahead and move down to the neck. I'm going to start with inspection. I'm going to inspect from all angles, look for to see if the thyroid is enlarged. I'm going to make sure that the trachea is midline. I'm going to look for any pulsations, any JVD. And then I'm going to go ahead and palpate. First I'm going to palpate. I'm going to start with the lymph nodes. So I'm going to go ahead and palpate pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental. Then I'm going to go down the superficial cervical chain, down the sternocleidomastoid muscle. I'm going to go posterior cervical chain and the anterior border of the trapeze muscle. I'm going to do the deep cervical chain with my thumb and my fingers down the sternocleidomastoid muscle. I'm going to go ahead and do the supraclavicular as well. I'm going to do the infraclavicular, and then go ahead and spread your arms out, and I'm going to do the axillary as well. Okay. I'm going to go ahead and palpate your carotid pulses one at a time. Okay, and then I'm going to go ahead and just make sure that your trachea is midline. In this case it is. I can go ahead and locate the suprasternal notch and put my finger on either side, on both sides of the trachea. Okay, I'm going to go ahead and go around and ask you to in order to palpate the thyroid gland. So I'm going to place the two pads of my finger, my first two fingers, and I want you to go ahead and swallow for me. And I'm going to place them right below the cricoid cartilage, and when he swallows I should be able to feel the isthmus. And then to feel the lobes, I'm going to go ahead and push the trachea to the right while I palpate the right lobe, and I'm going to push the trachea to the left while I'll palpate the left lobe, again feeling for any nodules. Okay. Then I'm going to go ahead and auscultate, and I'm going to auscultate with above my stethoscope for any bruise. To this side as well. And I'm also going to go ahead and auscultate the thyroid gland. Okay, then we're just going to go ahead and test your range of motion in the neck. So I want you to go ahead and put your neck back, okay, forward, and then I want you to turn your head this way, turn your head that way, and then to the side, okay, shrug your shoulders for me. Good. Then shrug them against me, my resistance. Good. Then I want you to push against my hand and push against my hand. Good. So we're going to move to the anterior part of the chest. I'm going to start with inspection of the thoracic cavity. I'm going to look at any, I'm going to look for symmetry, for contour. I'm going to look at any respiratory, his respiratory effort, any accessory muscles that are being used. I'm going to look for any visible pulsations or any heaves. Then I'm going to go ahead and just palpate the chest wall for any areas of tenderness, any masses that I may feel. I'm going to go ahead and palpate the pericardium area as well for any thrills, any heaves, any pulsations. While I'm here, I can also go ahead and palpate the apical pulse as well. Again, noting the intensity, the rhythm, and the rate. I'm also going to go ahead and palpate for tactile fremitus. So Brandon, when I put my hands on your chest, you're going to say 99 every time that I do that, okay?
99, 99, 99, 99, 99.
Good, and I'm making sure that I do feel the vibration symmetrically and there's no absent or decreased vibration. I'm gonna go ahead and check for your chest wall expansion, making sure that it is symmetrical. So I'm going to go ahead and ask you to take a deep breath in and out. Good, and as he's breathing in and out, I'm watching that my thumbs are moving out symmetrically, in which they did. So now I'm just gonna go ahead and percuss. Go ahead and lift your arms out for me. I'm going to percuss the lateral sides as well. Over here. And one more over here. Okay, and again, throughout the lung, I should hear sounds of resonance. I'm going to go ahead and auscultate. Listening for any adventitious sounds. So I want you to take deep breaths in and out through your mouth, okay? Lift your arms up for me. Okay, good. And while I'm here, I'm also going to go ahead and auscultate your heart, okay? So I'm going to go ahead and auscultate, starting with the aortic, pulmonic, nerves, tricuspid, and mitral. Again, listening for S1, S2, regular rate, and rhythm. Okay, we're done with the anterior part of the chest. I'm going to go ahead and ask you to turn all the way around for me so I can check your posterior side. Okay, so I'm going to start off with inspection again. Look for any gross deformities. Look at the alignment of the spine. I'm going to look at the skin for any lesions. Again, any signs of labored breathing. Then I'm going to go ahead and do tactile firmitus. So I'm going to do the same thing. You're going to say 99, okay?
99, 99, 99, 99, 99.
Okay, good. And then I'm going to also palpate for any costal vertebral angle. He shouldn't have any pain. And I'm going to do indirect percussion here as well. And as it shouldn't elicit any pain. Now I'm going to go ahead and also look for symmetrical chest wall expansion in the posterior side as well. So I want you to go ahead and take a deep breath for me. One more time. Good, and I'm watching that my thumbs rise symmetrically, which they did. Now I'm going to go ahead and percuss in the same way that we did the front. And again, we should hear areas of resonance throughout the lungs. I'm going to check for the diaphragmatic excursion. So what I'm going to go ahead and ask you to do, Brandon, is that I'm going to percuss down the scapular line, and then I'm going to ask you to take a deep breath in, and then you're going to hold that, okay?
Mm-hmm.
Okay, so go ahead and take a deep breath in. Okay, so I'm going to go ahead and just mark this area right here with a marker. And now I'm going to have you, I'm going to percuss up, and I want you to exhale and hold it, okay? Okay, exhale and hold it. Okay, and then I'm going to mark the line here from when the sound changes. When I was percussing down, it should change from resonance to dullness, and when I'm percussing up, it should change from dullness to resonance. And measuring it, normal should be between 3 to 6 centimeters. Then I'm going to go ahead and do the same thing on the other side, okay? So go ahead and take a deep breath for me, inhale and hold it. area. And then exhale, and then hold it, okay? So right here. And again, normally it will be between 3 to 6 centimeters, okay? So we are done with the back. You can go ahead and turn around now. Sorry, I'm gonna go ahead and auscultate as well. So just take deep breaths in and out, okay? Okay. Again, listening for any adventition sounds. Okay, you can turn around now. Alright, so now we are going to go ahead and move to the abdomen. So you can go ahead and scoot up for me and lay down. Okay, good. So I'm going to go ahead and just start with inspection. Look at the abdomen. Look at the contour, symmetry. I'm going to look at the umbilicus, making sure it's midline and not inverted, okay? Any visible pulsations and any masses as well. I'm going to go ahead and begin with auscultating all 4 quadrants, and this can take up to 2 minutes. Listening for any hypoactive, hyperactive, or absent bowel sounds. Okay, now I'm going to turn over with the bell, and I'm going to go ahead and listen for any vascular sounds over the aorta, renal arteries, iliac arteries, and then femoral arteries. Again, listening for any bruits. Now I'm going to go ahead and percuss. I'm just going to percuss to all 4 quadrants of the abdomen, listening for any areas of dullness over organs, any areas of tympany over air. Okay, now I'm going to go ahead and percuss for the liver border. So I'm going to percuss up the midclavicular line. And right here, when the sound changes from tympany to dullness, I'm going to mark that. That'll be the lower. Then I'm going to go ahead and percuss down the right midclavicular line. And again, I would point that and I would measure that, and it's usually between 6 to 12 centimeters. Then I'm going to go ahead and just percuss the spleen for any dullness. So I'm going to start in the end. I'm going to go ahead and just lay over to me, roll your side. There we go, and I can go ahead and start in the anterior axillary line around the 10th intercostal space, and just breathe in for me. And when he breathes in, I should hear tympany. Okay, you can go ahead and lay back down. Now I'm going to go ahead and just do just light palpation of the abdomen in all 4 quadrants for any masses or any tenderness. And I'm going to do some deeper palpation, again noting the abdominal organs, any mobility, any masses as well, any pain. Okay, and I'm going to go ahead and palpate. I'm going to go ahead and palpate for the liver. So I want you to just go ahead and take a deep breath in and out. And as he takes that deep breath in, I'm making sure that I'm pushing up to see if I feel the liver, the edge. Now I'm going to go ahead and palpate the spleen. So go ahead and take a deep breath in. And normally the spleen is not palpable. And then I'm going to palpate your kidney. Take a deep breath in. And then the right kidney. Take a deep breath in. Okay, good. Then I'm going to go ahead and palpate for the aortic pulsation. And I'm going to go ahead about 2 centimeters up from the umbilicus to the left of the midline with my finger and my thumb. And it should be between 2.5 to 4.5 centimeters. So we are, go ahead and just lift your head up for me. Lift up, and I'm looking at his abdominal muscles, and I'm looking for any hernias that may show up. Okay, you can go ahead and sit down. Alright, so we are done with that part. Now I'm just going to move on to the lower extremities. I'm going to start with inspection. Again, looking at the distribution of the hair, looking at the skin for any lesions, I'm going to look for any swelling of the knees. I'm going to look, touch his legs to feel the temperature. I'm going to check for any edema, any pinning edema he might have. I'm going to check the dorsalis, the pedal pulses, and the posterior tibial pulses as well. Intensity, rate, and rhythm, they should be equal bilaterally. And then I'm going to go ahead and also with the popliteal pulses as well. I'm going to check for your deep tendon reflexes. Okay, so the patella. Okay, and then the Achilles. You should see a plantar flexion when I do that. Then I'm going to go ahead and move over up to the extremities. Look for symmetry in the shoulders. Look at his clavicles. I'm going to go ahead and palpate, making sure that just feeling his muscle mass, any areas of tenderness. Go ahead and palpate your fingers, your joints for any nodules, any painful nodes you may have. I'm going to palpate your radial pulses. I'm going to palpate your brachial. Again, rate, intensity, and rhythm, and they should be equal. Check for the brachioradial reflex. I'm going to strike the tendon about 2 inches above the wrist. And then we're looking for flexion of the elbow. I'm going to go ahead and do this one too. Okay, and that's it. And I'm going to go ahead and just go ahead and ask you to stand up for me and just look at the cervical spine. So turn around this way. Again, looking at his back, making sure that this is the cervical spine is concave, the thoracic should be convex, and then the lumbar should be concave. So go ahead and lean forward and touch your toes. And as he's doing this, I'm standing behind him, observing for alignment of the spine, making sure there's no scoliosis and making sure it is straight. So you can go ahead and come back. Okay, you can take a seat. And I'm going to go ahead and test for just some strength. So go ahead and lift your arms up. Go ahead, push down against mine. Push up. Now go like that. Again, push up. Okay. And then you can go ahead and push down. Okay. So just testing the strength. And that will conclude the end of our head to toe examination.